Director of Communications and Media for Global Health and Humanitarian Response at Save the Children. And I'm here with Eric Starbuck, our Child Health Advisor and resident pandemic expert. Eric has a doctorate in public health with a focus on disease control, and he's been working on pandemic preparedness with Save the Children since 2006. So we're here to talk to you today about the coronavirus and all the things you need to know and to answer all of your burning questions. So thank you so much, Eric, for taking the time. It's so great to have an expert available. Can you start by telling us what is the coronavirus?
Right, so coronaviruses are a group of viruses, and there's 4 coronaviruses which cause the common cold. And then one type of coronavirus caused SARS, and there was a SARS outbreak that people may remember, may have seen references to recently, that was in 2002, 2003. And more recently, there's also a coronavirus which causes MERS, Middle Eastern Respiratory Syndrome coronavirus.
And so it's just a type of virus. It doesn't really specify what kind it is. Is it respiratory usually, or does it infect different parts of the body?
These are respiratory viruses, yes.
Okay. And how is it different from previous viruses like SARS and MERS?
Well, that's the key question now, and it's a new virus, and like MERS and SARS, it's related to coronaviruses in bats, and it may have actually originated from a bat coronavirus. So because of the experience of SARS that did spread out of China, but was contained in China and was contained in the countries that it spread to, that experience is very important. And I think a key focus of the research that's being done now is trying to understand what the similarities and differences are between SARS and the new coronavirus.
And so you said that this one may have originated from a bat?
Yeah,
or that SARS did?
Both.
Okay.
So genetically, the closest virus that's been found so far to the new virus is a coronavirus in bats.
And what are the symptoms of it?
Respiratory symptoms and fever, so fever plus cough. Fever plus other respiratory symptoms are the most common. There can be other more general symptoms as well.
Just general flu-like symptoms.
Yes, it's very similar to flu. And mentioning that is important because this is striking during influenza season. So there's a lot of respiratory viruses out there anyway at this time in the northern hemisphere, influenza and other respiratory viruses. So one challenge now is trying to sort out, who has this as opposed to who has another respiratory virus.
Right. And how does it spread? And why is it spreading so quickly?
Yeah, it spread probably, most likely, the going assumption is that it spread by respiratory means, like common colds or influenza. So it spread most likely by people who are coughing or sneezing or breathing within 3 to 6 feet, 1 to 2 meters of somebody else. That other person then gets that in their mouth, in their nose, maybe even in their eyes, and gets infected that way. So that can most likely be through respiratory droplets, which are expelled by the infected person who traveled 3 to 6 feet, 1 to 2 meters. But they're larger droplets, so they don't remain suspended in the air. So it's really the biggest risk is being in close contact with somebody within 3 to 6 feet, 1 to 2 meters of somebody who has these symptoms and who's infected with this virus. Then another mode of respiratory transmission is if somebody who has the virus, for example, sneezes or coughs into their hands, and then they touch a doorknob or some other object, and then the person who's not infected comes along and touches that surface. The virus can probably stay alive on surfaces for a few hours. So that's another mode of respiratory
created signs here at Save the Children that say cough and sneeze in your elbow.
Right.
For that very reason, just to stop
Exactly.
spread of viruses. And regarding why it's spreading so quickly, can you talk a bit about that? Because what you just mentioned, especially it affects travel and people in public spaces.
Yes. So why it's spreading so quickly is a key research priority now. So that relates to how many people one person who is contagious, how many people on average does one person who's contagious infect? And that is part of what drives the speed of transmission. And then the other thing that drives the speed of transmission relates to the incubation period and the interval between each generation of cases. So when one person is ill and then infects somebody else, and then they infect a third generation of people, between each of those generations, how much time elapses. So in influenza, that's a very short period of time. And the reason that flu spreads so quickly isn't because there's a high basic reproductive number. In other words, the number of people that are infected from one contagious person, that's low in influenza. But it still spreads very quickly, and the reason for that is it's a very short incubation period, and the interval between each generation of cases is only 2 to 3 days. So SARS had a much longer incubation period and serial interval, this interval between generations of cases, than flu does. So that's one of the reasons why SARS could be contained, whereas flu generally can't. So the hope now is still that this can be contained if the transmission behaves more like SARS than like influenza. And that's a key research priority at this time.
So when you say incubation period, you mean the time from which a person is infected to the time that they're showing symptoms?
Exactly.
So if that period is shorter, wouldn't you be aware that you're sick earlier and be able to kind of quarantine yourself?
No, but in a population, the speed at which an outbreak grows has a lot to do with the length of time between each generation of cases.
Okay. From the time it passes from one person to the next. Okay.
So that's a short period of time in influenza. In SARS, it was around 9 days perhaps for SARS. For influenza, it's maybe around 3 days. So that was one of the big differences between influenza and SARS, and that helped public health officials contain SARS, that longer interval. So
counterintuitive though, if it takes longer to show up,
Yeah.
wouldn't you think that they could spread it to more people before they even know that they're sick?
That question came up in a press conference just a few minutes ago by the senior leadership of the U.S. Department of Health and Human Services, the U.S. CDC, and the National Institutes of Health. And Dr. Fauci from the NIH made the important point that although the Chinese government has announced that there is transmission during the incubation period before symptoms appear, even though that may be the case, Dr. Fauci made the important point that that kind of transmission, pre-symptomatic, asymptomatic transmission during the incubation period, that's never driven an outbreak of respiratory diseases. So that may be a contributing factor, and hopefully it's a small contributing factor in this outbreak.
That's really interesting. So I think what everybody wants to know is, should I be worried? Is this something that could affect me and my family?
Well, that partly depends on where you are. So if you're in a part of China where there's a lot of ongoing transmission, then there's cause for concern, and the government of China is taking measures to try and contain and mitigate the outbreak, and there's things that people can do to cooperate with that and take measures on their own, and there's certainly cause for concern, immediate cause for concern, if you're in a setting where there's ongoing transmission. So right now, that's only happening in China. There's no reports of sustained or community transmission of this virus anywhere outside of China. There's been single cases exported by travelers, and now there's been 3 reports of just one generation of transmission from one person who traveled to another person who didn't. And that's only happened, WHO has said that probably happened in Vietnam in their report on Saturday. And there's stories in the press this morning that Germany and Japan, I think, have believed that may have happened with regard to just one small cluster of 2 people in each of those 2 countries.
And is that, you think, because they were traveling from the epicenter, that they took precautions to not be in public spaces? What do you think is containing that, the people who are traveling out of China with the disease, that's stopping them from spreading it to others?
Well, the hope is that the disease behaves more like SARS than like influenza. And if that's the case, then good public education about who may or may not be infected, about what the symptoms are, that people who do show symptoms of respiratory illness and a fever and have been in contact with somebody who may have had disease or traveled themselves from an area where transmission is happening, those people need to seek medical attention soon and inform their provider ahead of time of this. And then if these people who have gotten sick with this virus and have traveled or otherwise have gotten ill, infected by transmission from person to person, if those people can be identified quickly enough and isolated so that they don't go on to transmit the infection to other people, that's the hope that can contain the outbreak. And that's what did work in SARS.
That's very helpful to know. Who is most susceptible? Is it young people, elderly people, or is it just anyone who's in town?
So I guess susceptibility can be thought of in 2 ways, in terms of just who is at most at risk of getting infected and getting ill. And so far, most of the cases that have been reported have been in adults who are middle age or older. There's now been a few cases reported in children and young adults. And most of the severe cases and deaths in China have been in older adults and people with underlying medical health conditions. So it's kind of 2 different issues. One is, do you get infected? Then do you get sick? Then if you do get sick, how much are you at risk for severe illness? And it looks like that, how many children are getting infected and getting sick is uncertain at this time. It may be that they get infected and show mild symptoms only. It's uncertain.
And you already touched on this a bit, but what is being done to stop the spread of the virus on a global level?
Well, China is taking some very tough measures to try and contain it and to try and mitigate the outbreak. And I think, that's really so much in the news. I don't think there's, I don't need to go into that. In terms of trying to prevent spread outside of China, what's being done is that many countries are screening arrivals particularly from Hubei province, which is the province where it started in the city of Wuhan. And maybe that screening is now going to be extended to people who are arriving from all of China. So the hope is that the airport screening, even though nobody expects that the airport screening is going to catch everybody who comes in with the virus, but the expectation is it may catch some of those people through screening, and more importantly, that's an opportunity to educate passengers about the signs and symptoms and what to do if those signs and symptoms appear, and then to seek care immediately. And that's what's been happening in the United States with 5 cases. I think most or all of those cases weren't picked up in airport screening, but then at home they recognized the symptoms, got in touch with their health provider, and things worked out.
So the next question is, if you do feel flu-like symptoms, what should someone do? Should they go straight to the doctor, straight to the hospital?
Yeah, I mean, if the concern is respiratory illnesses in general, influenza, there's a lot of guidance on websites about when to seek care when you have a respiratory infection. If you've been in an area where there's been sustained or community transmission of this, and you have respiratory symptoms and a fever, then of course get in touch with the healthcare provider and let them know that you may have been exposed to this in a specific setting.
Okay, that's really helpful. We're going to take questions from Facebook supporters now. Here are a few. Are there any specific suggestions to help protect children?
Yes, there's been a lot of planning and a lot of experience with regard to protecting children. And that goes back over 100 years to experience with the 1918 pandemic, for example. That was also transmitted by respiratory means. That was influenza. So what was done then and what's been done in severe outbreaks of flu since then, and what's being done now in China is canceling schools. So try and reduce exposure of kids in school, in terms of kids going to school, being in school, educating parents to make sure that kids don't mix a lot with friends out of school. So these are measures that would be appropriate in a setting where there's community transmission, or maybe start that kind of an intervention right before community transmission is expected to start in a community. I think that's what comes to mind that's specific to school kids, but something like that is based on whether transmission is happening nearby and how severe the outbreak, the infection is. And in terms of severity, we really don't know yet how severe this is. That's one of the main uncertainties at this point.
That they're still looking into.
Yes.
So a lot of people want to know, how can they protect themselves and their family? Will a mask really help? Is it washing your hands, hand sanitizer? What can people do?
Well, that depends on where you are and what's happening around you. So one important thing is to stay aware about news about transmission near where you are. So if there's ongoing transmission of a respiratory virus near you, then you would want to do things like frequent hand washing, you mentioned, is very important. To prevent spreading the infection if you're ill yourself, staying home when you have these symptoms, respiratory illness and fever, except to seek medical care. As you mentioned earlier, coughing in your elbow, not in your hand, sneezing in your elbow, not in your hands. Masks are being worn a lot in Asia, and it's, I think, a difficult, complex issue. Most of the masks that are being used now, common surgical masks, medical procedure masks, are probably more effective to prevent transmission from the person wearing the mask. When you think of doctors and nurses in an operating room, they are wearing a mask not to prevent themselves from getting infected. They're wearing a mask to prevent infections of the patient that they're operating on. So typical masks are probably more effective in preventing transmission from the person wearing the mask than in preventing transmission to the person wearing the mask. A mask may be helpful, but it's probably not the most important measure you can take to reduce your risk of infection.
That would be hand washing.
Yeah, hand washing. I mean, if there's a lot of, if there's a severe respiratory outbreak in your area, then hand washing is part of it. But you would see what's happening now in China, that people are staying away from crowds and crowded situations and reducing their exposure. I mean, this is person-to-person transmission, mostly probably within 3 to 6 feet, 1 to 2 meters. So you want to stay away from people who have respiratory symptoms, and in a situation where things are very concerning as they are in China now, the government is taking measures to reduce the amount of contacts and the amount of close contacts between people. And people are reacting in that way themselves. They realize that this is respiratory transmission. They realize that it makes sense to, stay away from other people as much as you can if there's transmission in your area.
That is really helpful. So the last two questions I have here are, one, is there a cure for the coronavirus?
Yeah, that was addressed a few minutes ago by Dr. Fauci, who said no, there's no proven treatment specifically for coronaviruses. It's a research topic. In China, they're using different kinds of antiviral drugs to see if any of them will work. But at this point, it's a research topic.
Okay. And where can people go to get more information about the virus?
And I would suggest that if people are in the United States, then accessing the U.S. CDC, Centers for Disease Control and Prevention website at cdc.gov would be, I think, the first choice. For Europeans, the European CDC has an excellent website with advice. People in other countries may be able to access, excellent guidance from their own health departments, Ministry of Health. In the United Kingdom, Public Health England has excellent guidance. And then for everybody, the World Health Organization, WHO, has web pages on this, and that's another source of guidance and information.
Great. And you were saying that your personal favorite go-to is on the University of...
Well, if you want to stay up to date with news on a daily basis, my first choice go-to for the last 16 years, I guess, I think that long, has been the Centers for Infectious Disease Research and Policy, CIDRAP, at the University of Minnesota. So they have outstanding summaries of the state of the situation, and they post those in the late afternoon, early evening, U.S. Eastern Time.
That is really helpful. Thank you so much for your time, Eric.
Thanks.
Maybe we'll do another update later.
Great.
Thank you.
Thanks.
Thank you all for tuning in.